Hello everyone, my name is Dr. Poonam Jhadav. I am a dental surgeon by profession based in Indore and a person living with type 1 diabetes for last 29 years. I am also a certified diabetes educator, and the reason is that I am living with type 1 diabetes for 29 long years and a person who is dependent on insulin for managing blood sugars. So my diabetes was diagnosed in the year 1993, and at that time my insulin regime was bovine insulin for 1 month, and then gradually I was shifted to human insulins, that is human actropid and human insulatard. So the blood sugar monitoring at that time was very much difficult, and I used to go to laboratory to check my blood sugars. And now we have so many blood sugar monitoring devices like glucometers, we have flash glucose monitoring systems, CGMs, and many more. We have insulin delivery pumps, we have MDI regime, we have vials, insulin, so many technology to manage type 1 diabetes. During my childhood, it was very difficult for my parents. I won't say for me, because I was 6 years of age when I was diagnosed. So it was very difficult for my parents to manage my diabetes, because the eating habits and the different cravings during childhood are very difficult to manage for any parent. So it was, I would say that it was very difficult during my childhood. But as I grew up, 10, 12 years of age, my doctor used to say, start injecting yourself, please maintain your diet plans. And gradually, as I reached the age of 18, 20, I understood that I have to maintain my blood sugar so as to avoid the long-term complications of diabetes, which are very difficult to manage at a later age, whether it is renal complications or retinopathy, neuropathy, and many more. So gradually I understood, and during my school time and college time, my HbA1c used to be around 8 to 9%, but now I try and maintain my HbA1c to be around 6 to 7%. It is usually around 7%. So this is how my journey from my childhood to adulthood, and now I am at the age of 35. And I'm doing all of my daily chores, my work, everything on my own. I drive on my own. I go to my clinic. I go to my college. I'm also an assistant professor in a management college, and I teach management students. So I do all of my work on my own. And I won't say that a person living with type 1 diabetes cannot do anything a normal person or a non-diabetic person can do. So people, those who are thinking, or the parents whose children are diagnosed with type 1 diabetes, please do not think that your kids cannot do any activity, any games or dance or education, qualification wise. Your children cannot do what a non-diabetic child can do. So please do not think like that. We all can do whatever other people, other children are doing. We can achieve anything, but just you have to be vigilant. You have to have a good glycemic control over your diabetes, do more of monitoring, and please do not avoid taking insulin. People think that insulin becomes a habit, and we have to be dependent on insulin for our life if we take it for once. And this is the reality, that people living with type 1 diabetes have to be dependent on insulin for their lifetime. As we know that there is no cure as far as we know, and we have to wait for a cure for type 1 diabetes. So please have insulin and do not avoid taking it. And as far as the trekking, hiking experiences that people ask me often, you can do all these activities, but you have to be under supervision of a physician and your endocrinologist. Always get your checkups done, get your medications right, get your insulin traveling pouches, because at places where you have the temperatures in negative, like -1, -2, your insulin may freeze at those places, and where you have high temperatures, your insulin will again get denatured because of high temperatures. So maintaining the carrying the travel pouches of insulin is very important. You have to have a good medical checkup done before leaving, especially at extreme temperatures. So you can do whatever you are planning to do, but be under supervision of your endocrinologist. So this is all from my side. Thank you so much.